Call this March 26, 2024 regular meeting of the Burlington Board of Health to order. Please join me in a pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good evening, everybody. I am Dr. Ed Weiner, Chairman, and with me tonight are board members. First, Vice Chair, Mr. David McSweeney, his last meeting, Andrea Sheehan, Gail Demore, and Mary Beth Welch. Also with us this evening, Susan Luminello, our Director of Public Health, Michael Green, our Associate Director of Public Health, Marlene Johnson, our Health Agent, our Environmental Engineer, Christine Mathis, and Recording Secretary, Ms. Julie Falkingham. Please note that we are live on and we will taped by BCAT and available for appropriate comments and questions through this video technology. And as always, thank you for BCAT, for what you do for this community, keeping us all aware and so well informed. And tonight we have the privilege of an important BCAT professional. Mr. Chris Flattery is with us this evening. He is part of the Burlington Access Television production group. So thank you for coming tonight, Mr. Flaherty. We appreciate you being here. Approval of minutes, February 27th, 2024. You've all been sent, it's been sent to you. Do I have a motion?
So moved.
I have a motion by Mary Beth Welch, seconded by?
Second.
Andrea Sheehan. All in favor? Aye.
Abstain.
501. 401, I'm sorry. 401. Okay. Next, we have citizens' time. Is there anybody here who is not on the agenda who would like to speak to the board this evening? I see none. Ms. Luminello, is there anybody online who would?
No.
Okay, thank you very much. Chairman's report. I am going to limit my remarks this evening because we have a special event this evening to thank one of our Board of Health members who's been with us for 9 years. And I'm going to ask for a motion to move up Mr. David McSweeney appreciation to right now, because we have BCAT here who will film.
I think I should recuse myself, Mr. Chair.
Do I have a motion to?
Motion.
I have a motion. Second. I have a motion by Andrea Sheehan. Second, we'll give her a chance. We got Gail Demore. All in favor?
Aye.
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 I guess you could vote for changing of the.
Aye.
Okay. 500. 500. So, I'll start. For almost a decade, the Board of Health has had the privilege for the services of a nationally recognized corporate executive. Mr. David McSweeney has served the town as an elected official for 3 terms, working as both a member and vice chair, its current vice chair, ensuring the safety and health of this community, taking the reins from his well-known father, who served on this board for more than 30 years. It's going to be strange for coming here on a Tuesday night and not having a McSweeney sitting next to me. I want to thank David for his hard work, dedication, and most of all, his never-failing professional insight that we have all enjoyed. I'll stop right there before we have a little presentation and then allow you to say a few words. But does anyone else like to say something?
I would.
Please.
Thank you. David, it's actually been a privilege and a pleasure to sit alongside with you and partner with you in the Board of Health. I appreciate always your willingness to provide guidance, share your ability, and always find time on your own personal schedule to listen to a fellow board member when needed. You truly stood for the citizens of Burlington. I know your dad, a former BOH member, would be so proud. Burlington's really lucky, has been lucky for the time you've served and what you've given back to the community. What I will remember most is that you truly stood for the board is a 5-member board, and each member has a voice and a vote. I'm sure I'll be seeing you around town, but you'll be really missed on the board. Thank you.
Does anybody else, other professional staff, like to say something before we have a presentation?
Sure, yeah, I would. So I just want to thank David for his many years of service and always being there to help out when it was needed. We needed, anytime I called, you were willing to help out and to listen. And I knew your dad was a member of the board when I was on the board, and I know that he would be so proud of the things that you did and the things that you accomplished when you were on the board. Not only that, but you did it with kindness and professionalism. So I would really appreciate the many years that you served with us.
Thank you, Susan.
Susan, we have something from the board that you
Oh, yes.
carried along with you for...
Oh, my gosh. This is your life.
On behalf of the Board of Health and the town of Burlington, we want to present you with a thank you, a token of your service to this community. And it's something you won't have to set for 7 o'clock for Tuesday nights.
Oh, wow. David McSweeney, 2015 to 2024. Thank you for your 9 years of dedicated service to the town of Burlington, Burlington Board of Health. Thank you.
Wow.
Very nice.
Thank you.
Thank you so much.
David, would you like to say something,
I
please?
would like to say a lot. So first of all, thank you. This is very humbling. But even more humbling was being a member on the board. And, you know, my dad encouraged me for years to try to run for the Board of Health. As you know, he spent 37 years here working with most of you. And it was something I was like, yeah, you know, maybe. And finally, after I got him to, convinced him to hold a sign for me, because I did it for so many years as a kid, I decided to do it. And I thought I knew, you know, kind of the operations or what happened or transpires on the Board of Health, and I actually knew nothing. And it's been a humbling experience. I thank you. You welcomed me on my first year here, and I appreciate your mentorship and shortening my learning curve. I appreciated every single board member, prior and current, you know, Dr. Saltzman, Libby, you know, to the current board, you know, all of you, every single one of you, maybe don't always agree on every issue, but always treated each other with dignity and respect. And I always felt like you voted for the town in the way you thought best for that particular issue, and I totally respect that. This staff, I have to tell you, bar none, from top to bottom or left to right, from Susan down to Sarah, the receptionist. I mean, it's hard to leave just because of that. The programs and the dedication, the service you make to this community every single day, on weekends and nights. You know, I spoke with Chris at BCAT earlier, just going through the COVID pandemic and the tireless hours that you put in, and all the issues, and we had no understanding of what we were doing was right or wrong in trying to lead the town and the community through such an ordeal that was uncharted, was amazing. The dedication that the staff put into the community. And you know, you have, being on this board, you have some exposure into the other communities' boards of health. Nobody stands up to this Board of Health, and the town, the residents don't understand quite the amount of work and things you do on behalf of them and to protect them. So thank you. Hopefully this is not a retirement from public service, but just a sabbatical. And I appreciate every single one of you. I appreciate the confidence that you've had in me in some of the calls that we've had across the board. But I loved every single second, and I am going to miss everybody here and miss the work for the town. And hopefully I made just a little bit of difference in the community. So thank you.
Thank you so much. We'll get back to our regular agenda.
Can I go home now?
We've got at least one more hour. We have a variance this evening. Actually, we have a subcommittee reports. Are there any subcommittee reports? I didn't think there were any this evening. And then we have a variance. X-Golf, 10 Wall Street, regulation governing food service establishments. This will be led by our health agent and Marlene Johnson. Do we have something that they can sign in, so for the recording clerk? Ms. Falkingham, you've got a piece of paper, terrific. You got the correct spellings, please print.
Just our first and last name?
Yes, please.
Sure.
Please.
The permit holders are here from X-Golf, which is located at 10 Wall Street. X-Golf is an indoor golf simulator that offers limited food. Their menu is attached. There is limited food preparation. No raw temperature control for safety foods are prepared. All foods, except for some produce items, arrive frozen, pre-cooked, are stored frozen, and cooked frozen. They're not even thawed. There will always be 4 to 6 persons in charge who are also certified food protection managers. However, at times, seasonal employees who are persons in charge will not be certified food protection managers, and the owner or the permit holder is seeking a variance to allow this. The regulations, the Burlington Board of Health's regulation governing food service establishments, Section 3B, which is attached to your paperwork, requires that a person in charge be a certified food protection manager and be on duty and present at the establishment at all times that the establishment is open to the public and in operation. So the variance request letter is attached outlining alternative on-site procedures to ensure proper food handling procedures at all times, that the establishment is open to the public and in operation in lieu of the seasonal person in charge taking a certified food protection course and exam. So action by the Board of Health. If you vote yes to approve the variance, to allow the seasonal persons in charge not be a certified food protection manager with the following conditions. Seasonal persons in charge shall be trained by the owner or person or persons designated by the owner to train and administer the quiz to the person in charge. Provide a document or in-house certificate showing the seasonal person in charge have been trained and passed the quiz. The document or in-house certificate shall be available to the inspector upon request. Indicate on the person in charge schedule or other means who the certified food protection manager is on call and their contact information. This variance is for the establishment listed on this variance and no other location. This variance is approved for current owner on this variance and is non-transferable to new ownership. And violations of this variance may result in an appearance before the Board of Health and may result in a revocation of the variance. And I want to mention, there's no 3 strikes, you're out. If an inspector goes in and the person in charge doesn't have a certified food protection manager certificate or their in-house training and documentation showing that, they would be coming before the board. Or the board may vote no, not to approve the variance. So if you have any questions, feel free to ask the permit holder.
So I'll open this to the board first. How do you feel?
So this is all, I'm sorry, Mr. Chair, Dean Mahoney. This is all frozen food that's just, it's heated up or fried and served. It's not food prepped in the area.
Correct. It's mostly frozen food on our menu, and it's delivered frozen, and it's put immediately into freezers in our facility. We have 2 convection ovens in the store, and everything is kind of served on demand. If a customer orders an item off of our menu, it generally comes out of the freezer into the oven where it's heated to the proper temperature and served.
So this is a seasonal thing? Like what is considered seasonal that we're talking about? Is there times of days and times of years? I mean, I don't know if there's just a blanket that could be any time that we walk in or the certain time of year or day.
Sure. So X Golf is an indoor golf venue. We have 7 golf simulators.
And there, yep.
Okay, so, and when we say seasonal, when it's not the outdoor golf season, a lot of golfers get their, fix of golf by coming in to X Golf or a place like X Golf in the wintertime. So the wintertime is very busy. We're open 7 days a week, generally open from about 9 in the morning until 10 o'clock at night. Throughout the busy season, 7 days a week from, let's say, mid-October until mid-April. At that point, things do start to slow down. A lot of golfers go outdoors and play, and the store then ends up being, much less busy during that period of time, to the point that it's not uncommon to only need one person working there at a time, because we may only have 1 or 2 golf simulators in use. So the seasonality has to do with the amount of time that the simulators are being used, and that drops dramatically between, I'd say, April and October.
So for me, I have a comment and then maybe a change. So Marlene, I think so I'm worried about the precedence in a sense, right? Because we've had the issue, I think it was Dunkin' Donuts, that they weren't really cooking, they were serving donuts and they didn't have a person in charge, and we enforced it on them. So I have a little bit of a concern of the precedence that we might be setting here. If we do approve this as a board, I would like some definition around what seasonal is, like times of day, in months. Like, I just think a carte blanche or blanket that, well, we walk in June at 2 o'clock in the afternoon and you have one of these scenarios and you just say, well, it's a seasonality thing. Like, I think there needs to be some definition around the seasonality component. Okay. If we approve it, I still have some concerns over it. Like, I don't have concerns on what you're trying to do. I get it.
Yep.
I just think the precedence it sets might be, considering that we just enforced this a year or so ago.
I want to say that I have that same concern, David and board. We put this in place for a reason, and it seems like for every reason that a business has to modify or ask for a variance that benefits the business, it becomes a risk to, the people at large. And again, even though it's seasonal, I do see that are inviting people here for birthday parties, and there's other things that you're going to use this venue for. So I have that same concern with setting a precedent as being something that the board should take serious.
What is gained by not having them certified? Is it a monetary?
So the monetary is not the issue here. The staff that we have 3 or 4 what I would call managers who are fully food protection managers certified. A lot of our staff are part-time young people who have second jobs and in some cases even third jobs. They might do this one day a week for us, even in the wintertime, and in the summertime, a lot of them go off and do their other jobs. But some of them stay on very limited hours. So the requirements to go through CFPM training is sometimes difficult for them. They just don't have time to do it, and they have a hard time understanding, why do I have to do this? I'm not a manager. I don't get paid to be a manager. I'm making a relatively small wage, and they just don't really have time to go through the training. I mean, the training for CFPM is rigorous, as you know. It's about an 8-hour exam, 8 hours of class study and then an exam, and it's a fairly large commitment on their part. Plus, the curriculum for CFPM is much broader than what we're doing. There's a lot of the curriculum that talks about handling raw meats, that talks about handling raw fish, that talks about the requirements for the facility that you're in to make sure, the facility is kept up to date. And a lot of the servers that we're talking about don't have that level of responsibility. There are times in the summer, like I said, where we can go an entire shift from 9 in the morning till 5 in the afternoon without one customer coming in. We don't have a kitchen staff because, the model is very low overhead. It's just take a frozen pizza and put it in the oven, and 5 minutes later it's cooked and they bring it out. So we can't afford to have more than 1, maybe 2 people during these slow days in the summer. And I can't always rely on that one person being a certified food protection manager because it just hasn't been feasible for us to put them through that degree of training.
I will tell you that I agonize over this. I am a food protection manager. I took the course. It was a terrific professor who gave it. Marlene was a trainer. I studied for the course, and it was a difficult course. It's a difficult study. And I guess the pass rate is about 50%?
Yes.
About 50% pass rate. And I did well, but I've been in business a long time. It bothers me that we're talking a season of 7 months. We're talking 6, 7 months is a season. And I feel that it does do what it's supposed to do. It protects the community. But I do understand this is very limited use of what they were going to be doing. My issue is that we're entering uncharted waters here, and we haven't really done this before in this time. And I'd hate to approve this, if we're going to approve this for a complete year. And if we do approve this, I think that during those seasonal, if our staff feels so inclined, so intent in doing this, that we should add a number of extra review, and that could be additional visits to the facility for inspections. So I'm not sure that this is the best thing for the town. I'm not sure whether we should do this for forever. The season is a very long time, and I'm open to a compromise here, but I'm going to tell you that if it ain't broke, don't fix it, is what I'm thinking. And as my other board members feel the same way. So I will open this up to the board of what you would like to do and how you would feel. Either, as Mr. McSweeney said, we all have a vote. We all have our own opinion, and I'm not sure if there's any excitement for this or not. So I will leave it open. So, any other comments? Do I have a motion to do this? If I have no motion, then it fails. Do I have a motion to approve? Thank you very much for coming. I don't have a motion to even discuss.
Okay.
And I've heard great things about your company. I'm not a golfer, but I've heard some great things, and I guess the board feels uncomfortable. But we wish you well.
Thank you.
Thank you.
Okay, which brings us to next order of business. We've been waiting for this. Hearings, codification of Burlington Board of Health regulations. We have all received.
Hey, Mr. Chair, before we go on, do we have to vote on that, don't we?
On what?
Oh, no.
On the variance?
No,
Would they vote?
no, there's no motion, we don't vote.
I mean, if you could make, somebody could make a motion to vote no, I suppose, to deny. You could make a motion
I
to
don't,
deny.
the variance is still out there.
Kinda left open.
Yeah.
Do we have?
I mean, I mean, I know they just left, but I mean, I don't have a problem making a motion to deny the
It
variance.
might clean it up a little bit.
Yeah, that's what I'm thinking.
Yeah, because I don't have a motion to vote. I have no motion to.
Yeah.
Yeah, so somebody would have to make a motion and
So,
second.
go
right?
ahead.
Yeah, so I'll make a motion to deny the variance for ex-golf to
Second.
Wall Street.
You want to wait till, when we wait till?
I think she said aye. She said aye. On the way out.
She said- Just wait 1 second, we'll take a 2-minute. Keep you here a little longer. We don't want you to leave.
I just spit out the word aye.
Chris, thank you very much for coming. And I hope you didn't mind me calling out your excellence.
It's always nice to see you, Chris.
Yes.
Good night.
Thanks, Chris.
Bye, thank you.
I'll send it when it's all over.
That'd be great, thanks.
So I have a motion by Mr. McSweeney. Do I have a second? Did I have a second by Mr. Mori? As soon as our fifth member comes back. Vote.
Anybody have a joke?
Not one that I can say on.
Right?
Well, nobody is on tonight to be watching, although they could be on
I'm sure they're on BCAT.
BCAT.
That's I mean, we could still vote. She would be abstained, right?
We could.
I don't know how that would work if she wasn't in the room. Would she be, she wouldn't be abstained, it would be the,
It would just be for,
Just
Yeah.
give her one more minute.
okay. I just feel bad for the people watching.
We're watching.
Yeah.
Joe?
Spouses.
Susan Pierce, it makes me feel closer like a host. That's why. Susan's logged in on us.
All in favor? We're waiting for you.
yeah, if you need to leave.
Would you say all in favor?
Aye.
I'm in favor of.
Okay, all in favor? Aye.
To deny the variance.
All in favor.
Aye. 5-0-0 to deny. Okay. Which brings us to the codification, Board of Health regulations. A lot here to read,
Yeah.
but there's nothing
Years
different.
of work, right. Yeah, so it's, what it is, and I have talked about it in the past, it just took some time to actually get it all done and make sure it was done correctly. But it's taking all of our current regulations and putting them in one manual with different sections. So now, as you can see, we have, it might be Article 1, Article 2, Article 3, and then Section 1, Section 2, et cetera, and putting them, and also clearing up references, such as references to certain regulations, so that they're all the same in all the regulations, making a abbreviation type of page in there, also referencing the regulations that we enforce that are not local regulations. So, for example, the state regulations that we enforce, like the state sanitary code, things that are enforceable by us but are not a regulation that's passed by the board. So if we have any changes to these regulations, what would happen would be we would change that certain section of this manual, and it would be a change to the entire manual if a regulation changed, or if we added a regulation, so you could add it as an additional section type of thing. And all the references, again, when you add it, should all be the same as we're moving forward. So if you're referencing a certain, regulation, it's going to be consistent throughout the document. Let's see, so we also have a list of federal laws and regulations, federal, state, and local regulations and laws that are referenced in here. So, for example, in the biosafety regulations, we reference the CDC BMBL, so that would be listed in that Appendix B. And then documents that actually would be Appendix C, that's a document included and incorporated into our regulations by reference. So, and then the table of abbreviations, and then we just have a record of when it's amended, and each article says when it was adopted, and then if we revised it, it would go when it was revised. So everything will be in the same place, basically. So I don't know if anybody has any questions about it, or the reason why we started this is because the town clerk asked us to, thought that this would be a good way to have our regulations so that people would be able to easily reference them.
And all of the departments are doing the same at this point. So I know it's taken a long time, so thank you very much. The date on here would be today if we passed it?
Yeah.
And would you then have to advertise this?
No, it's been, I would advertise that it's been approved, yes. And then certified copies are sent to Mass DEP, and that's where you send all the regulations. So I'll send those certified copies along to them, and then that will make it official. And it'll go on our website. We've already started working on it, where it's going to be put on the website as articles. So it'll be clickable on the website. You'll be able to just click it as an article.
How much work was hours?
It was a lot of work, yeah.
Huge, it's taken tremendous.
And thank you to Sarah. She did a lot of work with me on the whole thing, too.
So I'm sure you all looked at it. It looks beautiful.
I liked it.
Yeah. Do I have a motion to approve?
So moved.
Mr. McSweeney,
Second.
second by Mary Beth Welch. All in favor? Aye. 500. Again, thank you so much, Susan, for doing this. The next is 2024-2025 vaccine purchase recommendations. So, as many of you know, my youngest son, my youngest, is a global executive for the company that we buy our vaccine from. So therefore, I have been asked to recuse myself when it comes to discussion the purchase of vaccine. And therefore, I have to pass the gavel for the last time to Mr. McSweeney. I'll be outside. Please knock when you're done.
Clarification. Mr. Chairman, did we vote on that? We do.
Yeah, we voted on
Okay.
that, yeah. It's 5-0.
Okay. Okay, so the 24-25 flu season purchase, I took a look at last year's numbers and provided them here. I did it by age group trends over the past 3 years. So as you can see here, the high dose has kind of stayed the same over the past 3 years. We've given out less, or last year we gave out less of the regular dose. So we purchased 450 doses, but we only gave out 335. And we held clinics, and we used our MRC nurses to, to come to the clinics. We had a full-day clinic. It just didn't seem to be a whole lot of interest as in the past.
I did have a question about that. Thank you for the stats on that. Because I was going to ask that, it wasn't decreased a lot, but I saw
Yeah.
your stats, but it's just there's so many other opportunities for folks to get that. I mean, is there something up for, I know you use it as your emergency response drill, but is there thought maybe of, I'm thinking of how much money, you have to have a police officer, your staff, preparing that. I understand using it for emergency response drill. Maybe there's something else, right? But it's just, I'm thinking of, it's kind of.
No, that's a good point. Yeah, so last year, I really toned down the emergency response drill process.
Okay.
And really, that was because, we have the emergency dispensing site plan, which we're supposed to be using for years and years and years to plan for a pandemic. We're going to hold a big, clinic if we have to give out this vaccination. Then we had the pandemic, and we weren't giving it out. The state didn't give us the vaccine, to go through we did initially, but we weren't later on. So, we were prepared. We know how to do it. The staff is trained, the MRC volunteers are trained. But that's a good question. Do we really need to have the big drill every year where we're practicing this, especially if it happens, we're not going to be giving it all out in one day type of thing. Really haven't got a lot of clarification from the state. What is the plan now? What is the emergency dispensing site plan now? Mike is still participating in the Region 4AB Emergency Preparedness Coalition. They still haven't really done a lot of planning around that. We haven't, so it's something that I'm not sure how it's going to go in the future. So to answer your question, I think it provides a good service to the town, especially for the older folks who I think find it easier to just come to the Board of Health or come to the Grandview Farm.
That
at a certain
I agree.
time,
I'm thinking, just for the few times I did participate in the lines, it's probably definitely changed a lot, because it was a big turnout when it first
past,
started.
yeah.
Mm-hmm.
Yeah.
I think that, do they just come to the office now? They make appointments and come to the office?
So we did it
Right.
different ways last year. So we had, instead of the whole emergency dispensing site
Right.
thing where we have, the whole staff involved and, have it at the school and have police and ambulances and things, we didn't do it. We just had a smaller one at Grandview Farm, did like 6 to 8 stations. I think Mike was really the only staff and the MRC volunteers that came. And, now with the vaccination software, it goes really quickly. We get people in and out. So it was just, I liked it a lot better at Grandview, the smaller thing. I think a lot of people said to me, this is great, type of thing. So, and we held one, I think we did it on a Saturday, and then we held smaller ones up in the office in room 207 for the seniors, because they're downstairs and they're like, oh, you're giving out flu vaccine, and they come upstairs to get if they haven't been vaccinated yet. So that worked out really well too. So, I think, so I guess my recommendation this year is to tone it down to the 400 doses. We could probably even do less, I suppose, but, and then keep the 150 doses for the high dose, because we did give that all out. So they,
and we can sell back, there's a certain percentage,
they
right?
take, it's 15% they'll reimburse you for, so, of what you purchase. So, it's 15% of the 450, so what's that, 60-something doses. But then we have 115 left, so we get stuck with that. Also, too, I started giving it out under the Vaccine for Children program, but the state will provide flu vaccine for children in the Vaccine for Children
Yeah.
program, so I can just request more flu vaccine from the state if we're going to give it to the kids during these regular clinics.
So do you feel like the number is pretty good then, that you want the recommendation? Like even, because I am worried about the dispensing of it, and I'm more worried about wasting the dollars, if there
Yeah.
are any dollars wasted, right? But then again, I want to make sure we have enough here, so I know it's a fine line. So with that, like 15% reimbursement back from the state, what's our risk? Like, you think it's like 100 doses that could be our risk that we don't give out? And we can't.
Well, so, yeah, I mean, what did we did 335, and I'm saying 400, and that would be, if we do 400, we could cover, most of get reimbursed for that. But, every year, I feel like I'm pushing the flu.
Yeah.
Like,
Yeah.
come get your flu, come
I
get
think
your-
there's so many other,
Well, because there's so many places you can get it.
yeah, you can walk in, get a
Yeah.
gallon of milk, and
And I think,
Right.
too, it depends,
plus if you
like,
get
on
your
what type
COVID.
of flu season it is.
Yes.
Although last year, I seemed to be not, everybody seemed to be getting something last year, but we still weren't getting a whole lot of calls about, hey, do you got any flu vaccine? Probably because it's readily available.
Yeah.
In the past years, if we're the only one that has it, it's gone, right? But, now,
So maybe,
everybody has it.
So what were you proposing? I'm sorry, my laptop's dead.
400 doses of the regular dose and 150 of the high dose. But I was saying is, we could even go less.
Yeah.
so what did
think
we
so.
use for the high dose last year? 100?
We almost used it all. So I think I only got like 5 doses left or something.
144, is that the number?
Yeah.
Is that right?
And so we'll get reimbursed for
There were
those
4
doses that were not used.
that were-
Because that's part of the 20%. So that was
That's
good.
not an issue.
And even too, like even.
And the high doses are for elderly, so for senior
Yeah,
population?
65 plus.
Gotcha.
Yeah. And so those go well, but, you get those people who, I guess, they always got it at the Board of Health, they like coming here to get
Yeah,
it.
and it's a great
I
community
think it's a
service for
good
sure, yeah.
program.
Yeah. So, I mean,
So maybe we stick with the 150 high dose and then just tailor back the
you
rest.
think less on the 400?
I do.
yeah,
Well, I mean,
I do.
Yeah, I mean, I don't, and I hate to say this, because I don't really mean this, but I'd rather run out than have some on hand that
pay for stuff.
we lost.
Right.
Right. All right, so how about like 300 doses of the regular and 150 of the
Sounds good.
high dose? And then we'll just give them out. The nice thing now is that you make an appointment. So
Right, yeah.
if we reach 300, we're good. Because
Right.
I always used to worry in the past, oh my God, there's a line and we don't have enough vaccine.
Yeah, it's
But I
different.
don't have to worry about
That's
that
different.
anymore.
I mean, I wish there was 1,000, right, or 2,000, I would say buy 2,000.
Right.
But I just don't want to see anything go to waste.
Yeah, and it is nice, for, like, we give it to the firefighters and the
Yeah.
police and stuff, so that.
Do you go into the schools? I couldn't remember.
We do, we've
Yeah.
given it to the schools. Sometimes
Yeah.
they'll bring somebody in though for professional
That's
development
true, too.
day,
Yeah,
and
yeah.
they'll give them
Just like
out.
other companies do.
Go to
They-
health fairs
Yeah,
and give it out,
yeah.
but,
I think reducing it,
Okay.
I think reducing it too, especially where we,
yeah.
took a loss last year. Like you said.
Yeah.
Yeah.
Obviously
So
we didn't
last
use
year,
all
we
the,
gave out 335. I guess if we reduce it to 350, that'll be the same as
Same.
last
Yeah,
year.
let's do it.
Okay,
I think that's fair.
all right.
Do you need a vote on that?
I don't have to.
Yeah.
I think, I just kind of want to, like, make the board aware
Yeah,
and
no.
make it a sure
Thanks.
decision as far as what we're working on.
I think
you
it's,
know?
yep.
Okay.
I was looking at that. Thank you for providing
Thank you,
this data.
Susan.
Yep.
I'll go get the chairman. Set it. Thank you.
You can continue.
No, that's okay.
Okay, thank you so much. Board of Health meeting schedule revision. We found that there was a date, May 28th, that for some reason was left out of our Board of Health meeting schedule. This is just some housekeeping, unless anybody remembers or has any idea why it was taken off the 28th.
Was it Memorial Day?
I think
That's the day before.
No, yeah,
It's the day,
it's the day after.
the day after
It's the day
Memorial
after.
Day, it's Tuesday after, I don't know.
So maybe because of
Maybe
the
that was-
posting of the, we wouldn't have
There
enough
was a
time to
discussion,
post? You'd
I
have to
can't
have it
remember.
Friday, but then it wouldn't be able, you'd have to have it in by
I
Thursday?
posted a day earlier.
You posted
Yeah.
Thursday, yeah, I
We
think
may or may not have to meet that day, but we should.
there was a discussion, I clearly,
I do not remember.
maybe
You
the
can
day.
start adding it back in, and that,
And then we get the discretion, if we need to cancel, we can cancel. Could I have a motion, please, to place back in our schedule that single day?
Motion.
I have a motion by Ms. Sheehan. Is there a second?
Second.
Second by Mr. Maury. All in favor? Aye. 500. Okay. Brings us to staff reports. Health agent.
Good evening.
First of all, let's introduce Marlene Johnson, and thank you for being here this evening. It's a real pleasure.
Thank you. I took a week-long plan review course that FDA had put on, and although I do plan reviews now, it was just, it was able to strengthen my skills, and I learned a lot, made some new contacts, because it was a virtual webinar, or course, rather. Met a lot of people throughout the whole country, so that's always nice, too. And tomorrow, we are having our food safety forum. We have about 15 people signed up, food establishments in town. And we have a presentation. It's going to be at the Hilton Garden Inn, so we were able to use some grant money to pay for a nice room there and do a nice presentation for folks. And the topics are employee health and personal hygiene. I have a booklet that I downloaded from FDA that will be given out. And we're going to review the food employee reporting agreements. We're going to talk about imminent health hazard reporting, and we also have a poster that was made that we'll be giving out. So we're looking forward to it. It's going to be a 2-hour presentation. So looking forward to that. Are there any questions on my report?
Any questions? You had one Burlington Fire Department MFEs?
A mobile food establishment?
Yes. Was there
Yes.
any?
So they, after they have their inspection with me, they are sent over to the Burlington Fire Department. The fire inspector checks their propane, and if they have any cooking equipment, if they have ventilation, that's checked by them as well.
Thank you.
You're welcome.
Just to point out to everyone that these reports, all of them this evening, will be from February 16th through March 14th. Okay? There is actually two of them, the 16th through the 29th and the 1st through the 14th. So there are on all of these reports this evening.
Do we have to approve them separately, or?
No, we can do them all at once.
Okay, all right, thank you.
Motion to approve the health agent's report.
so moved.
Second,
It's Ms. Sweeney, second by Mary Beth. All in favor?
Aye.
Aye. The next is the environmental engineers report.
Good evening. I wanted to just announce that the Household Hazardous Waste Spring event will be on May 18th, Fox Hill School. And it looks like we'll be able to have a few more events there before they start construction on the new school. That's not scheduled to start until 2026. So, and then the other item I wanted to just make you aware of is we recently received the biological safety permit application from the Broad Institute, and they'll be coming to Board of Health meeting for their permit either in May or June. And they're shooting for occupancy for September of this year.
Wow, it's outstanding. Any questions for our environmental engineer? I have one question. The transformer spill, it was mineral oil, no PCBs whatsoever?
No, it was a relatively new transformer.
Okay, good, thank you very much. As the board knows, we used to cringe every time we had one of those explosions because they were filled with PCBs, but those days are over now, so.
Well, some still do. I mean, some, you do run into older ones every once in a while, but they're few and far between.
Thank you very much. Do we have a motion to approve the environmental engineers report?
So moved.
Second.
Motion by Mary Beth, second by Andrea. All in favor? Aye. Thank you. Associate Director of Public Health.
I don't have anything on the board, or for the board, except the Community Health Fair is actually coming up on Saturday, May 11th, from 10 to 1 at the Burlington High School. We got a lot of great vendors this year. We've got hearing, vision, injury, and mobility screeners that are going to be there as well. We have a bunch of exercise demonstrations and some wonderful raffle prizes being raffled off. So hopefully that's another great event this year.
It keeps getting bigger every year. I love it. It's awesome.
Yep, we got the Safe Trailer hopefully coming this year. The fire department puts on a demonstration about kitchen safety.
How many years now? Is it 5 that you've been doing it?
7 or 8.
Yeah, it started when Wayne was chairman.
Oh, that's right, that's right.
It was a memorial.
Memorial, yeah, memorial.
Oh, my God, that's right. Remember the traffic? Yeah, that was, yep, okay, you're right. It's been
Yeah, I
longer
think
than that.
Roberta was here, but that, it was the,
Yes, yeah.
Goulash?
yeah.
Yes, all right, I remember. Is it?
Oh, we get more and more, residents showing up every year too, which is great.
Yeah.
So first, I want to thank you for all your work you did to make the VVRC annual meeting a great success. It was a terrific evening with a very internationally recognized microbiologist, Dr. DiMaria. It was a fabulous evening. Nice crowd. It was terrific. It was incredible to be able to get him, just incredible. I also want to thank you for the bias training from Dr. Khan. Dr. Khan was fabulous. Again, I go to all of these, and she is just tremendous, and you can pass that along to her. And then you had some training. Now, for animal, I have to bring it up, animal decontamination in radiation incidents. Tell us about that.
That one was an interesting one. They did bring up a lot of good points for, you're dealing with contamination of people first, but a lot of people are not going to leave home without their pets. So you have to take that in consideration, that you're not going to just have people coming through. You're also going to want to have some experts that know how to deal with animals. Similar to when we had Dr. David Schwartz do the pet preparedness, having those experts there ahead of time and having a plan for how to, split up, decontaminate people and pets separately, but then being able to bring them together, reunify. It's a rather large process, and the exercises they were showing were on the county level with 27 different organizations participating in it. Obviously, for us, we would scale that down and just have local vets and healthcare facilities and decon teams, fire departments, participating. But still, that would be quite an endeavor.
Very good.
You don't even think about some of these things, right?
Yeah, that's interesting.
But they need to be dealt with, right?
Yeah.
Crazy.
It's amazing.
Yeah.
Any questions? If not, could I have a motion to approve the Associate Director of Public Health report?
Motion approved.
Motion, is there a second? Second was a motion by Andrea Sheehan, seconded by Gail Demore. All in favor?
Aye.
All right. And then Director of Public Health, Susan Luminello.
Yeah, so I just wanted to talk a little bit about the 23 to 24 school year vaccinations. We're kind of winding down. We have one more clinic scheduled for May. I think we have about 25 students on that. So I kind of just put the statistics together because I wanted to see where we were at. Right now with the color software, it's so easy to just kind of pull them up. So as you can see, we did quite a few vaccinations, over 100 students throughout the year with very varied types of vaccinations. The state contacted me a couple of weeks ago and wanted to talk about vaccination for the shelter in Burlington. But, we've been vaccinating all along. We've been doing this for months. I think we've gotten probably all of the school-age kids that are staying in the shelter, as well as the kids who don't have insurance that are not staying in the shelter, that are staying in apartment complexes. So I did a thing on the housing just to kind of get an idea of how many from each apartment complex or areas of town that have come to our clinics. So I'm supposed to be meeting with them again. They were going to get a list of kids who in the shelter who may need vaccinations. Probably going to be the younger kids, the kids that are not school age, because those are the ones really that we don't know about, that we haven't reached out to. But everybody else we've reached out to. We're working very closely with the school nurses, and they're giving us information on who needs vaccines. I'm supposed to be meeting with the schools in April. I requested the meeting because I want to make sure that if kids are getting enrolled in school over the summer, that we're not slammed in September and October like we were last year. I want to kind of get a jump on it if we can, so that way we can kind of start the vaccinations during the summertime, so we're not trying to get them play catch up in September and October. So I'm hoping if we can do that, we might be able to continue them over the summer as well. And then we have a community, I know you're all familiar that Jackie had left the community health outreach position. We, the coalition members interviewed someone today, or did interviews today, so I'm hoping that we'll have somebody in that position soon, and they can work with these families on navigating the Mass Health system and how to get a pediatrician for their children through Mass Health, so that they can not only get the continued vaccinations but regular physicals. So that's something that I really want the community health outreach worker to work on with these families, and so that we're not continuing this, that they're getting the proper health care and know where they can find those resources. So that's an ongoing thing. But I don't know if anybody has any questions about these statistics. As you can see, most of them are Spanish-speaking.
Any questions? A couple of
I have a question that's kind of off. It wasn't on your list of, I didn't see it in your list of things, but I noticed the TriCon newsletter.
Oh, yes, did that
And I
get
thought
sent to you?
Yeah.
So that was
Is that
something that
something else
Katie-
that's worked on through the grant? Or?
Yeah, so
Okay.
Katie, the epidemiologist,
Okay.
did that, and it really, the intent is to keep all the board members from the 3 communities, as well as like other towns have had their staff or other municipal leaders on the list, keep them informed of what they're working on, what that staff is working on, and what they have to offer. Because, for example, that another community might not know that the public health nurse is doing Stop the Bleed and might want to, have it in their community. So just trying to make all the board members in all the communities aware of what they're doing. Just a way to keep everybody.
I thought it was good.
Communicating. So hopefully she's going to be doing that on a monthly basis, so you'll be seeing those again.
Okay. That's a lot.
Anybody else? I want to thank you for coming with me. We spent a morning together doing the budget subcommittee with the Ways and Means subcommittee, and we spent a couple of hours working with them, and it was excellent. Also, I want to thank you for coming with me to Ways and Means in the evening. We had to sit around and wait, as always, but they're very professional. Ways and Means is very professional, and we had a very good meeting with them. And the moral of the story is they approved our budget without revision. So thank you for spending all that time.
I should be thanking you for coming with me.
You tolerated me. So I'm going to stop right here. We also have, as usual, the Associate Health Inspector, and since that comes under you, under this, Samantha Hardy is our Associate Health Inspector. And does anybody have any questions to our director or to our health agent about her report? Again, that report is February 16th to March 14th. I had none.
One, under the administration for the report from the 16th to the February 16th to the 29th, maybe I'm just not reading this. It said call with the RJ, the owner, discuss cigar pricing and potential violation at, so is it the same owner for both?
So what it was one owner from one of the retail tobacco
Called on
shops
another owner?
told Samantha that a customer told him that the other retail tobacco shop were selling their cigars at a lower price than what he was selling at. So she went and did an
So he could get
investigation and
his
did not
competition
find
shut
that. So,
All right.
yeah, so did not find that. So we think that maybe the customer was fibbing.
Yes, kind of sounds like it when you read it.
To get a better
Yeah,
rep,
he can shut down his competitor.
Now,
No, trying to get cheaper cigars from.
Oh, okay, all right.
No,
sorry.
Yeah.
Oh, all right.
now
What a
is,
waste of poor Samantha's time.
Right.
now is that illegal for someone to sell a cigar cheaper than another store?
Well, they have to follow the regulations, so the regulations actually have a minimum price.
A minimum?
So, yeah, so they were claiming that they were selling cigars at below the minimum price in the regulations, the customer was, to this retailer.
I learned something this evening. Then again, I don't smoke cigars. So
That's it.
I actually had a question for you too, now that I'm thinking about it. There was something with an employee restriction at Legal Seafood?
So what had
Is that-
happened, so what had happened is an employee was ill, went to the doctor. The doctor had them submit a sample, a stool sample. It came back positive. So then we were notified, and so depending on what that pathogen is, if they're a food employee, sometimes they can be restricted, which means they just can't work around food. They could
But
maybe
they
do
could still
office
like,
work.
okay.
Right, so that was what that was.
I
that
was
they-
just curious, I've never seen that.
Yes, and so we follow it up with a letter, so that way the manager knows, and we copy the employee.
Of course.
And then they can't go back to their regular job duties until
They're cleared.
they have a negative, right, and we're
Okay.
notified of that. And then once we're notified of that, we send out a letter, we contact the manager, we say, okay, the employee can go back to their regular job duties now.
Interesting.
So, yeah,
That's it.
Thank you.
you're welcome.
So can I have a motion to approve the Director of Public Health's report, which includes the Associate Health Inspector?
So moved.
I have a motion by Mary Beth Wells, second by Vice Chair David McSweeney. All in favor?
Aye.
500. Mr. McSweeney, would you please give us a motion to adjourn?
Motion to adjourn, last time.
To a second?
Second.
The second by Mary Beth Welch, a family event. All in favor?
Aye.
All in favor? Aye. Good night, everybody.
Go vote next week. Not for me, but go vote.